everyone, welcome to TryRight. This is Path 365. Myself is Srija. So today you're going to learn about the CPT coding guidelines for section of pathology and laboratory. So in this session, you're going to learn in detail about the guidelines regarding pathology and laboratory. So how are the sections of pathology and laboratory are classified under CPT? So first of all, what is the purpose of pathology and laboratory guidelines? So the pathology and laboratory section of CPT contains diagnostic test, screening test, monitoring test, and consultative pathology services. So always read the guidelines at the beginning of each subsection before selecting a code. So there are headings and subheadings. So what are the headings? They are the major categories. Coming to subheadings, these are more specific groups within those categories. So these headings help you to understand what types of service is being described and they know what is included or excluded from each code. So there are asterisks. So what does it mean? So subsections marked with the star symbol. So they have a special instructions, unique coding rules and additional guidelines that must be followed. So these instructions often appear before the code listings in the parenthetical notes. So ignoring these rules result in errors and coding accuracy gets denied. So what are the placements of guidelines? So when special rules apply, guidelines appear before the CPT codes. So they apply only to that specific subsection. So code ranges may not be sequential. So codes are listed as they appear in each subsection even if numbers are out of the sequence. So the same code appears in another subsection. So never assume the numerical order. It is the correct order. So what are the subsections in the pathology and laboratory guidelines? So the first subsection is organ or disease-oriented panels. So what are listed under organ or disease-oriented panels? So panels is nothing but it's a bundled lab test. So these are used when all the components of the panel are performed. So the code ranges are 80,047 to 80,076. So example like basic metabolic panel, BMP and hepatic function panel. So they do not unbundle the panel components. If one test is missing, build the individual test inside. So the second subsection is drug assay. So with drug assay, the code ranges are 80,305 to 80,377. So these are used to detect the presence of absence of the drugs, drugs of the abuse testing and examples like urine drug screen and blood alcohol testing. So what is the important point here? It's a presumptive versus definitive testing matters. So and also methodology matters, whether it's an immunoassay or chromatography. So they affect the code choices here. And therapeutic drug assays. So these are used for measuring the drug levels for patient management. And also these are used for narrow therapeutic index drugs. For examples, digoxin level, phenytoin level and lithium level. So what is the difference from drug assay? So therapeutic is nothing but monitoring the drug level, whereas drug assay, it detects the drug use. Evocative and suppression testing. The next section is evocative and suppression testing. So the code ranges are 80,400 to 439. So these are used to evaluate the endocrine function. They access the hormone response after stimulation or suppression. So what are the examples under this subsection? Glucose tolerance test, ACTH stimulation test. So ACTH stimulation test. So adenocorticosteroid, thyroid hormone, thyroid stimulating hormone. So these are often includes multiple time specimens. They follow the guidelines carefully to avoid the undercoding. And next is pathology clinical consultations. The codes are 80,503 to 80,506. So these codes which are listed under this subsection, they are used when a pathologist provides a medical judgment or interpretation goes beyond the routine lab reporting. So examples include abnormal coagulation interpretation and also the complex lab result correlation. So this must include the written report. These are not built for routine lab review. And urinalysis, the codes are 81,000 to 81,099. So urinalysis codes, they include dipstick testing, microscopic analysis, automated versus manual testing. So there are difference between with microscopy and without microscopy. So specimen handling also affects the code selection. And next subsection is molecular pathology. The codes are 81,170 to 81,479. So generally these are used for DNA or RNA analysis, genetic mutation detection. So the examples include BRCA testing, oncogene panels, and these are divided into tier 1 specific genes and tier 2 less common genes. And next is multi-analyte assays with algorithmic analysis. So the code ranges are 81,490 to 599. What does this mean? So these are the tests that measure multiple biomarkers. So the results are processed through a proprietary algorithm. They provide a single risk score or interpretation. So what are the examples? Cancer risk scores and cardiac risk panels. So they don't code individual components separately. Algorithm must be medically validated. So very commonly tested in certification exams. So next subsection is chemistry. So chemistry subsection, it includes the codes which are related to blood and body fluid chemistry test. For example, like glucose, electrolytes, liver enzymes and cholesterol. So many of these tests are a part of panels. So always check if a panel code applies before billing the individual test. Hematology and coagulation. So they include the blood cell count, coagulation studies like CBC, hemoglobin and platelet count. Immunology, what it includes? Antigen antibody testing, immune system disorders. So examples like ANA, rheumatoid factor and allergy testing. So methodology like EIA, ELISA and IFA may also affect the code choice. So frequently these are the tested areas under immunology. And next is transfusion medicine. So transfusion medicine, it includes the blood typing and also the compatibility testing. So the examples are ABO typing, RH factor and the cross match testing. So testing codes are separate from transfusion procedure codes. So next, microbiology. So it includes how it detects the microorganisms. So examples like culture, sensitivity testing and also smears. Preparation of the smears, application of the smears. So organism identification and sensitivity testing may be separately reportable. So culture versus rapid test is also as important in this microbiology section. Anatomic pathology. So it includes the examination of the tissues and organs like autopsy services and gross examination services, which is different from clinical pathology. So these are often combined with surgical pathology services. And cytopathology. The code ranges are 88,104 to 199. So they include the study of cells but not the whole tissue. Examples like pap smear and fine needle aspiration cytology. So the screening versus diagnostic pap codes differ here. And the imaging guided FNA is also coded separately. Cytogenetic studies, 88,230 to 299. It includes chromosome analysis as well as the genetic abnormalities. So examples like karyotyping, fish studies. So they are often linked with oncology and prenatal diagnosis. These are usually a highly specialized codes. So surgical pathology. So they include examination of surgically removed specimens like biopsy specimens and resection specimens. So generally levels 1 to 6 based upon complexity. So specimen type determines the code but not the diagnosis type. And in vivo laboratory procedures. So the code ranges are 88,720 to 749. So these are the tests which are performed directly on the patient. So examples like transcutaneous bilirubin, breath testing, and there is no specimen removed here. This is a very limited code range of these procedures. And other procedures, they include miscellaneous lab procedures which are not fitting other categories of the pathology and laboratory subsections. So examples like the body fluid analysis and the cell counts. Reproductive medicine procedures, the code ranges 89,250 to 89,398. They include the fertility and assisted reproduction services. So examples like semen analysis, IVF related lab work. So these are very highly specialized procedures. They are often bundled with the reproductive services. And proprietary laboratory analysis. So the code ranges are 0001U to 0520U. So these include the unit tests which are developed by your specific labs and CMS recognized proprietary assays. So these are generally listed under category 2 CPT codes. And coming to the first category, first subsection, organ or disease oriented panels. So what is the purpose of the panel codes? So panel codes, they are created for coding convenience only. They are not clinical guidelines. So each panel lists defined components that must be performed. So a panel code can be built only when all the listed components are performed. So panel codes, these are not fixed. They are fixed. So you cannot substitute the test. So you cannot partially bill a panel. For example, if a panel requires 8 tests and only 7 are performed in a patient record, so do not build the panel. So you have to build individual CPT codes instead. So this is how you have to assign the codes for panel components. And additional tests can be built separately. So if extra tests are performed outside the panel, they may be built separately. For example, they has given BMP panel plus magnesium. So you have to add a magnesium CPT code plus on as an additional code for BMP panel. So do not report the overlapping panels together. So never report two panel codes that share any of the same test. So this applies when test comes from the same patient collection. So this prevents the double billing of the same lab test. And what is the overlapping panel rule? If a test overlap between two panels, you have to report only the panel with more components and you have to report the remaining test individually. So what is an example? So report 80053, the larger panel, plus individual codes for remaining test. So do not report 80053 code with 80047. Why? Because these are the overlapping panels, right? So next is a drug assay. So what are the drug assay subsections? So the drug related lab testing is divided into three major categories, three major subsections. So what are those? Therapeutic drug assay, and chemistry based drug testing. So generally this code selection depends upon the purpose of the test and the type of test obtained. So therapeutic drug assays. So these are generally used to monitor the levels of a known prescribed medication. So it helps to adjust the dosage and avoid the toxicity. For example, digoxin level, phenytoin levels, lithium levels. So is the patient drug level within the therapeutic range? So this tests the answer. So second is the drug assay, the drugs of abuse, which is used to detect the presence or absence of the drugs. So these are generally often used for substance abuse screening and compliance testing. So examples like urine drug screen, blood alcohol testing. Is the drug present or not? And next is a chemistry-based drug testing. This uses analytical chemistry methods. It is often for confirmatory test. And examples like gas chromatography and mass spectrometry. So two major categories of drug assay. So presumptive drug class testing and definitive drug class testing. So what is a presumptive drug class testing? So what it is? It's a screening test which is used to identify the possible use or non-use of a drug or a drug class. So this is often the first step in the drug testing. So here the results are usually qualitative, whether it's a positive or negative, whether it's a present or absent. So sometimes it is a semi-quantitative. So it does not identify a specific drug. It's a faster and lower cost procedure. So the common methods are immunoassay and dipstick urine screens. So reported using presumptive drug class CPT codes. So one code may represent multiple drugs within a class. So coming to definitive drug class testing, what it does? It confirms the specific drugs and metabolites. So this is used when exact identification is required. So this can be qualitative or quantitative. It identifies the specific substances. So this is more precise and more expensive. And it is used for legal cases, pain management compliance, and confirming the positive screens. So what are the common methods used in definitive drug class testing? Gas chromatography and mass spectrometry. So what is the important rule here? A presumptive test is not required before a definitive test, and providers may order the definitive testing directly. So both may be reported only if both are medically necessary. And the specimen types are drug class testing may be performed on the urine, which is most common, blood and oral fluid like saliva, meconium, which is a newborn testing, and hair. So always check the code descriptor. So some codes limit the specimen type. So what are the types of results here? So depending upon the testing purpose, results may vary. So they may be qualitative, whether it's a positive or negative, and semi-quantitative, the approximate amount, and quantitative, the exact measured level. And therapeutic drug assay, TDA. What is the purpose of TDA? It monitors the known and prescribed medications. It ensures the therapeutic level and avoid the toxicity. So what are the key characteristics of this therapeutic drug assay? Typically quantitative, specimen types, whole blood, serum, plasma, and CSF, cerebrospinal fluid. So the examples are digoxin, lithium, and phenytoin. So TDA monitors the medication levels, not the drug misuse. So modify 59 rule here. So when the same drug test is performed on a different specimen types, example like blood drug level, urine drug screen, so report the code separately. Append the modifier 59 to indicate a distinct procedural service. So without modifier 59, the claim may be denied as a duplicate testing. And next coming to presumptive drug testing method. So what does presumptive means? It is used as an initial screening. It identifies the possible presence or absence of a drug or a drug class. So it does not confirm a specific drug. So the presumptive methods include immunoassays, examples like IA, EIA, ELISA, enzyme immunoassay, RIA, radioimmunoassay, EMIT, and FPIA. So these are very fast, inexpensive, and common urine screening tests. So what are the enzymatic methods? For example, like alcohol dehydrogenase, which is very commonly for ethanol. So this is often used for alcohol screening till it is considered as a presumptive. And next are the chromatographic methods without mass spectrometry. So examples like TLC, thin layer chromatography, HPLC, high pressure lower chromatography, GC without MS. So without MS, this cannot definitely identify the drugs. Whereas the mass spectrometry without adequate drug resolution, examples include MSTOF, DART, DAISY, LDTD, and MLDI. So if MS is used without chromatography, it is still presumptive but not a definitive process. And what are the definitive drug testing methods? So what does this definitive mean? So definitive mean it confirms the specific drugs and metabolites. It has a high accuracy and specificity. It is used for the compliance, legal, and pain management testing. And what are the definitive methods include? So what does they include? They include only the gas chromatography with mass spectrometry. Example GCMS and GCMS or MS, which is a tandem mass spectrometry. And also the liquid chromatography with mass spectrometry includes LCMS and LCMS or MS. So chromatography plus mass spectrometry is a definitive method. And explicitly it is excluded from the definitive immunoassays as well as the enzymatic methods. For example, like alcohol dehydrogenase. So what is a presumptive drug class screening? So what are the coding rules here? So first you have to screen, then you have to confirm it later. So drugs or drug classes are often screened with presumptive testing and confirmed with definitive testing. So coding depends upon the methodology used but not the intent. So what are the CPT codes involved here? 80305, 80306 and 80307. So these codes, they are generally method based but not the drug based. So what is the important rule included here? Each code represents all the drugs and drug classes tested by that method on the date of the service. So do not code per drug. Do not count number of the panels. So what these codes include? They include all the drugs tested, all the drug classes tested, and all the sample validation procedures such as pH, specific gravity, nitrite, creatinine, and adulterant checks. So never code the validation separately. So there are three method categories. So what are the method types? 80305. The method type is visual, dipstick, or a card method. Whereas in 80306, it includes the instrumented immunoassay. And 80307, it includes the instrumented chemistry analyzers. So only one presumptive code per date of the service per method is assigned. And CPT code 80305, which is a visual drug screen. So no machine reads the result. A human looks at it. So what is the method here? Direct optical observation. So that means the provider or the lab staff looks at the color change or the lines. So examples include urine dipsticks, drug testing cups, cards, desk strips, and cartridges that show a visible line or a color. So you have to think of it like a pregnancy test strip. So you look for lines with your eyes. So report 80305 only once per a date of a service. Do not bill per a drug tested. So even if 10 drugs are screened, you have to still assign the code 80305 once. And CPD code 80306, instrument assisted optical drug screen. So in this, a machine helps to read the result, but it's still an optical test. So what is the method? The test device using cup, card or strip. It is placed into a reader machine that interprets the lines or color changes. So examples like urine cup is inserted into analyzer, cartridge is read by small desktop reader, and automated dipstick reader. So what is the main difference from 8035 to 80306? So in 80305, the human eye reads the result, whereas in 80306, the machine reads the result. And there is no analyzer in 80305. When compared to 80306, it has the analyzer which assists the method. And 80305 code description, it's a manual process, whereas 80306, it's a semi-automated process. So you have to report 80306 once per date of service. It is not billed per a drug class. And code 80307, it is for instrumented chemistry analyzer, which is an advanced screening method. So this uses the laboratory analyzers and chemistry methods, which is a more complex and more accurate than cups or dipsticks. So what are the methods included in code 80307? These involve the biochemical or chemical lab technology. So the immunoassay methods like EIA, ELISA, EMIT, KIMS, RIA are included here. And chromatography. So in chromatography, we have GC, the gas chromatography, and HPLC, high performance liquid chromatography. And mass spectrometry, the screening level, it includes LCMS, GCMS, MALDI, TIBO-F, and DOT-DC. So these are still a presumptive screens, not a definitive confirmation codes. So those are 80320 to 80377 range. So 80307 is also billed once per a date of service. So this is used when testing is done on the instrumented lab analyzers only. So this is more complex than a simple cups or the readers. And this is about the code 80305, 306 and 307. So next is the definitive drug testing. So what is a definitive drug testing? It is used to prove exactly which drug is present. It identifies a specific drug molecule. It can tell the difference between drugs that look similar. And it is used when results must be legally and medically reliable. This is confirmatory testing but not a quick screen. So what makes a test definitive? So definitive test uses advanced chemistry instruments that analyzes the chemical structure of the drug. So they can identify the individual drugs. They can distinguish between the structural isomers with the same formula with this different structure. So they usually cannot distinguish the stereoisomers. So stereoisomers are the images which are the mirror image forms of the same drug unless a special methods are used. So what are the methods used in the definitive testing? So these are the high complexity laboratory methods. The GCMS method, the gas chromatography plus mass spectrometry, and LC or MS, liquid chromatography plus mass spectrometry. So both can be a single mass spectrometry and also tandem mass spectrometry. So these methods, they separate the drug, they break into fragments, and they identify it by its molecular fingerprint. So what is not a definitive testing? So these are the screening methods, even if done on an analyzer. So immunoassays. So coming to immunoassays, they are EIA, ELISA, RIA, EMIT, FPIA. So what are the methods used in? So these are the methods used in definitive testing. like gas chromatography and liquid chromatography. So what are the CPT codes for definitive drug testing? The code ranges are 80,320 to 80,377. So these codes, they are based upon the drug classes, not the test method. So you bill per drug class confirm, but not per the instrument and not per the drug level. So what are the types of results? So definitive test can be type quantitative, qualitative, or both. So qualitative is nothing but whether checking of whether the drug is present or absent. So quantitative, it measures the exact drug concentration, and both indicates the presence plus amount. So all are still reported under the same definitive drug class code. So what are the reporting rules here? So each drug class is reported once per date of the service. It includes the metabolites of the drug. Do not bill separately for the parent drug plus metabolite. Do not bill multiple units for same class, same day. So if what is an example? If testing confirms the oxycodone and oxymorphone, which is a metabolite, so both fall under the opioid class. So one code only. So you have to assign only one code. And next, coming to therapeutic drug assays. So this is a different category from the drug abuse testing. So what is the purpose of therapeutic drug assays? These are used to monitor the levels of a prescribed medications. For example, like digoxin, lithium, valproic acid, vancomycin, phenytoin, and specimens like blood, serum, plasma, and CSF. So why it is done? Because to make sure the drug level is not too low, not ineffective, and not too high, which is a toxic. So these have their own CPT codes, not in the 80305 to 80377 range. And examination is quantitative. So coding is by the parent drug. Measured metabolites are included. So what does this sentence mean? Therapeutic drug testing measures the exact level of a medication in the blood to ensure the safety and effectiveness. So these tests are quantitative. So they give a number, a drug concentration. So what is the coding principle here? You code for the main drug, that is a parent drug. So if the lab also measures the metabolites, you do not code them separately because they are included under the main drug. So example, patient is on carbamazepine and the lab measures carbamazepine, which is a parent drug, and a carbamazepine epoxide, which is a metabolite. So you report only the carbamazepine CPT code once. So metabolites, they are considered a part of a same drug test. And next, evocative or suppression testing. So what does this mean? This is an endocrine function testing, not a drug abuse testing. So this test check how a gland responds when stimulated or suppressed. So a substance is given to stimulate hormone production, that is an evocative test, or suppress hormone production, that is a suppression test. So then lab levels are measured at the multiple time points. So what is an evocative testing? Stimulation. So we go something that should increase the hormone levels. For example, ACTH stimulation test. So what does this ACTH stimulation test do? What is the purpose of it? It checks the adrenal gland function. It checks the cortisol response. Whereas the growth hormone stimulation, it checks for GH deficiency. So this is the evocative testing. And coming to suppression testing, we give something that should decrease the hormone levels. For example, dexamethasone suppression test, it evaluates the Cushing syndrome, and glucose suppression test, it evaluates the growth hormone excess. So these CPT codes, they are for the lab testing portion only. They do not include giving the drug, IV infusion, injection procedure. So those are coded separately under 96365, 96376 code ranges, which are infusions and injections. So why some code says into 2? So if a code says something like cortisol 82533 into 2, so that means cortisol is measured 2 separate times, for example, baseline level and post-stimulation level. So you report the analyte code based upon the number of measurements. So this is about the evocative and suppression testing. So coming to pathology clinical consultations. So this is not a lab test again, it's a professional service. So it is a service which is including a written report provided by a pathologist when another provider requests the expert interpretation. So when is this used? A treating physician might ask a pathologist to interpret the complex lab findings, to review the unusual blood smear results, and to advise on the further testing. So the pathologist reviews the data and provides a formal written consult. So this is a billed as a consultation service, but not as a lab test, but not as a pathologist specimen exam. So it always requires a request from another provider and also a written interpretive report. So what request can be made by? So the request does not have to be a formal paperwork. It can be a written request. It can be electronic request, phone request, and face-to-face request. But it must come from the physician or another qualified healthcare professional. So what is the criteria that must be met? You can only bill 80503 to 80506 codes when all of these apply. What are those? First one, there is a request. So the pathologist must be asked to provide an interpretation, not just automatically reviewing the results. So second one is it involves a medical interpretive judgment. So this is more than reporting the numbers. The pathologist must analyze the lab abnormalities, pathology or findings, clinical history, operative notes, radiology or other diagnostic information. So a written report is produced. So the pathologist documents their expert opinion in the writing. So when you cannot use these codes, when there is a routine lab result reporting and automatic computer generated interpretations, pathologists reviewing their own test without a consult request. So whenever there is a technical lab work, you cannot use these codes. So next is urinalysis. So what is urinalysis? So we have many codes which are classified under urinalysis. So what are those? 81,000 to 81,050. So these all codes come under urinalysis procedure. So UA with microscopy, UA automated plus microscopy, and they also include many urine qualitative test, microscopic exam only, urine pregnancy test. So what if the urinalysis test isn't listed? So if the urinalysis procedure does not match one of the standard UA codes, so you have two options. So what are those? Option one, you have to use a chemistry analyte code. So if the test measures a specific substance, code it from the chemistry section. 82,009 to 84,830 section. For example, urine calcium. So you have to use a specific calcium test code. And the option 2 is you have to use the unlisted codes. 81,099. This is used when there is no specific analyte code exists and there is no standard urinalysis code fits. So this usually requires documentation and the manual review by the payer. And next is molecular pathology. So what is a molecular pathology? So molecular pathology test analyze the genetic material, DNA, RNA. So the goal is to look for gene changes, for example, like variants or mutations that can cause or influence the disease. So these tests, they can detect the germline variants, the somatic variants, and the histocompatibility. So the germline variants, these are the inherited genetic changes. So somatic variants these are the acquired changes in the tumors. Whereas histocompatibility, the tissue is matching for the transplant. So what is the key coding rule here? Molecular pathology CPT coding, it is based upon which gene is being tested but not the method used. So even if it is a PCR, sequencing or other methods are used, the code depends upon the specific gene. So what are the two main categories? So category 1, the tier 1 codes, which are commonly tested genes with their own specific CPT codes. So the tier 2 codes, these are the less common genes grouped by complexity level. So the tier 1 codes, the tier 1 molecular pathology codes include 81,061 to 81,200 to 81,383. So these are generally used for well-known, frequently tested genes. So each of these genes, they has a specific CPT code. For high testing volume, which is a very common in clinical practice, and the code lists the gene name. Tier 2 molecular pathology procedures. So these are used when the gene being tested does not have a tier 1 code. So these tests are less commonly performed, often for rare diseases, and grouped by technical complexity and also the physician interpretation report or effort. So the tier 2 levels, these are generally divided into levels 1 to 9. So they also have the lower levels and higher levels. So lower levels generally it has a simpler testing and less work, whereas higher levels it has a more complex testing and more interpretation. So specific genes included in each level, they are listed after the CPT code description. So Tier 2 coding, it is based upon the specific gene tested, the assigned level for that gene. So what if the gene isn't listed? So if the gene is not in Tier 1, not listed under any Tier 2 code, you have to use 81479. So which is unlisted molecular pathology procedure. So this requires detailed documentation as well as a manual peer review. So germline versus somatic testing. So germline, it includes the samples like blood and saliva. So the purpose of germline testing is inherited disease risk. And the purpose of somatic is for cancer treatment decisions. The sample source is the tumor tissue. So coding is still based upon the type of gene, not whether it's a germline or a somatic. So these are the guidelines for molecular pathology, the Tier 1 molecular pathology procedures and Tier 2 molecular pathology procedures. So this is for today's session. I hope this session has helped you. So the next session, you're going to learn some more pathology and laboratory guidelines in the CPT coding. Thank you.